It's clear that a lot of the people in this country are exhausted with the polarization and how the national leaders on both sides are only concerned in energizing their base. This is not what we are in our communities. Liberals and conservatives work together all the time.
We listen to a rhetoric that says we're divided, but in reality on the ground we're not.
At first, the work we were doing was about how to craft messages better, and then to becoming better messengers ourselves. Just because somebody doesn't agree with me, they're not crazy. They are rational, they have reasons, and there's still a way to broker something together to help our local communities who are so desperately in need from opioids and obesity and any of the other issues that are out there.
We have a real responsibility here. We have a responsibility to not play our political games. As we do so often, we're in there to make our spiel, and we go in with an agenda. We want to make sure we cover every single point, and sometimes, you know, one or two of those issues is what will resonate. So by listening to the people that we're talking with and allowing it to be a dialogue, we can, I think, more quickly move forward, because I believe that they understand our intent is sincere and genuine, and we can have some appreciation for theirs.
One of the issues that a lot of our members had brought to us in the past was concerns about how do you deliver a message about public health to not only people who might not be public health professionals, family, friends, but also policymakers. How do you make sure that you're delivering the right amount of information to them, explaining it to them in words that they're going to understand, that represent their morals, their concerns? Because one of the things we do know is that a one-size-fits-all message just doesn't work anymore. We don't want politics and, you know, Facebook posts and other things among friends and family to stop a conversation that needs to be had. And so I think you know, really pulling all parties together, making sure that folks understand that we're really not that different, and we can find a way forward. A lot of it is just about how we talk to each other about these issues.
Crafting richer messages and being more credible messengers gets its importance from the fact that we in public health have good ideas. There are a lot of ways that we can make life easier for people, make it healthier, create a greater opportunity for well-being, take away some of the barriers in the path towards health. Having the right idea is the first step, but convincing a lot of other people that it is the right idea is completely different. And you can't just assume that the evidence that you're basing your idea on will carry the day. We have to find a way to speak more to the heart and more to the moral values of people if we want them to get excited the way we are with the idea.
If we can begin to be in the heart-changing business, I think we can make tremendous strides.
Messaging is absolutely key, because that's how people's hearts and minds are changed. Sometimes when we message, of course, we provide the scientific data, but not everybody buys into that. We need to understand the power of words, and I think that's really important in terms of messaging around health disparities and social justice.
The core insight of this initiative is that we have a lot more to work with than we frequently know we do. So many public health people feel a deep sense of frustration about not being able to communicate with the public about the public, and we get stuck. And I love that we're actually sort of releasing the natural passion, the natural compassion of this field of public health for everybody in the public. And I think we're sort of finding our voice, and we're finding that it resonates in ways that we've have sort of forgotten what a jewel we have.
I hope the work of crafting richer messages and being better messengers explodes. I hope it goes everywhere. I hope it is an accessible movement that's about being authentic, empathetic people, that's about pursuing the public health policies and partnerships that we want to see happen, but also about the way we do it. And I think that's something that everyone is talking about and wants to talk about, even if they don't use the phrase crafting richer messages. I think it's much bigger than what we do, and I want to see it kind of trickle down around and everywhere into public health.
This initiative is so much fun, and it's really fun to work with a group that is so committed to the heart of public health. And every time I come to one of these presentations and work with the groups that we're speaking to and hear their feedback, I'm just reminded of why I wanted to be in public health.